and we are live, sir.
Okay.
Hi, everyone. Welcome to this FB live session. Today's session is going to be very interesting. If you're overweight or obese, have tried all the weight loss program, you are scared of surgical treatments. So the only option left for you is gym or dietitian, then you are in for a surprise, guys. Because today we are going to be talking about a non-surgical hidden gem for obesity treatment. Hey, hi, I'm Prateek Mathur, founder of MOP Obesity and a weight loss expert. And today we are going to be talking about Intragastric Balloon, a hidden gem in obesity treatment. And to talk further about it, we have Dr. Vivan Talwar, who's a proctor in Intragastric Balloon and is been doing for almost about 13 years. We have been training doctors for Intragastric Balloon. And Dr. Vivan, for all of you to know, is a senior consultant gastroenterologist in New Delhi, a trainee from Maulana Azad Medical College. He emigrated to the United Kingdom in 1997, where he pursued further studies. Having spent over a decade there, he moved to Holland for a fellowship in advanced endoscopy. In 2009, he moved back to India with a CCST and MRCP degrees in gastroenterology and internal medicine, In India, he joined the prestigious Max group of hospitals in Saket, where he worked for over a decade. It is while working here, he was awarded a fellowship from the Royal College of Edinburgh, this becoming only a handful of gastroenterologists in Delhi holding a CCST and FRCP in gastroenterology. Today, he has established his own center in GK2, where he continues to practice, called Talwar Medical Center, and there we are also running our MOP Obesity. Welcome, Dr. Vivan Talwar.
Thank you, Prateek.
And thank you for taking out time and coming for this live session, sir.
Thank you. You make me sound very important. That's very kind of you. But no, it's a pleasure to actually be here and speak about what you very, very appropriately said is a hidden gem.
Yes, sir. Absolutely. If you can just throw light on what exactly is the intragastric balloon, because there are new patients, there are new people who are not aware of intragastric balloon. They know that they are obese or overweight, but they don't know where to go. So can you talk about something about the non-surgical approach?
So I think that's the most important thing. What you said, it's one of the few non-surgical options a person who's overweight has to lose weight. Historically, it's always been surgery or medication, which as of today, we don't have very successful medication.
Correct.
So intragastric balloon is basically a procedure which we do endoscopically. We take an endoscope, put it through the mouth, insert a balloon under direct vision. We're looking into the stomach. We inflate a balloon. The balloon size is, if I can show my hands, approximately this size.
Yep.
It's still in the stomach. The amazing part about the procedure, it's 6 to 7 minutes to put in. It's 6 to 7 minutes to take out. There is no cutting. There is no anesthesia. We do use a small amount of sedation just for the patient to be comfortable, but there's no anesthesia. So it's basically a 5 to 10 minute procedure to put in, remove out, and it's aimed at losing weight.
Correct. Sir, if with your permission, I mean, if you can explain it with the animated, we have got an animated video. So I think it would be better for our, viewers to. So if with your permission, I can just share you.
Please do.
Is it right? Perfect. So I'm going to be sharing you the insertion first, sir. So, so if you can just go through the. Can you see, sir?
Yes. So basically, this is an angle just showing how we are putting the endoscope in. So normally, once the endoscope is in, we'll put the balloon through the mouth. The balloon at this point is deflated. It's put into the stomach. Under direct vision, we start inflating the balloon with essentially saline or water. The size of the balloon is we put about 500 to 700 ml of water, and I decide there and then on a case-by-case basis whether you want 500, 550, 650, depends on the stomach size.
Right.
Once the balloon is inflated, we disconnect the balloon and we remove the endoscope. This procedure total from start to finish is about 6 to 7 minutes.
And so this one is the removal. So if you can just explain it quickly so that we can move as well.
So this is typically done, Prateek, around 6 to 7 months after insertion.
Right.
We go back in with an endoscope. We puncture the balloon with a needle and a pipe. We suck out the fluid. This again takes about maybe 3 minutes. Once we've sucked out the fluid, the balloon deflates, and we pull the balloon out through forceps, which is basically like a grasper. It just holds it, and we pull it out through the mouth. So the beauty is in both the procedures, insertion and removal, there is no cutting, there is no surgery. The patient will not have any bleeding, nothing.
Okay, fantastic. So it looks like very simple process, sir. But is it a simple process?
So I think anyone who, okay, it's like driving a car, isn't it?
Right.
You have to be trained to drive a car, number one, and you have to be trained to drive a car safely.
Correct.
Right? So endoscopy to endoscope is not very difficult. To endoscope safely is different. Right. To insert a balloon, remove a balloon looks very easy. You have to be trained. As simple as that.
Yes.
You go to a car mechanic, you go to a barber, you go to anyone, you want someone who's trained. Is it simple? It's simple if you are trained.
Correct. And I think we have also seen that, putting in the balloon is easier than removal, I guess, in our past experience, sir.
Yes. I mean, we have done over 500 balloons, I think, Prateek, you and I together since 2008, 2009.
Yes, sir.
And, over the years, we have come across all the possible difficulties. Someone super overweight, someone very apprehensive, someone coming instead of after 6 months, comes after 9 months, which is not recommended, but it causes complications for us. And we've learned that putting in is actually very, very easy. Taking out is far more difficult. Yes. Right. From a patient's perspective, it doesn't matter. They are sleeping. Correct. Right? I always say to the patients, you're not working, I'm working. So correct. Putting in is easy for me. Right. Taking out is easy for me because I'm trained. But from their perspective, putting in and removal is actually very easy.
Right. No, in fact, this was my second, the question that was coming up, because people will say that, of course, endoscopy is very painful. They have a lot of bad memories of endoscopy to be done. So as you rightly said, I mean, it would be done under sedation, right?
And yes, and again, I would like to clarify something.
Yes, sir.
Most endoscopies done across the world are done with a drug called midazolam. Right? In midazolam, you are awake, but you don't remember.
Correct.
The balloon, because we have to be careful, we actually do it with another drug called propofol.
Okay.
In that, you are properly asleep. So some patients who've had endoscopies and have had a bad experience saying, the doctor said to me, I'll be sedated, but I wasn't sedated, I remember. That's different. Propofol, you will be asleep. You will not remember anything, which is good, because if you remember something, you'll hit me. So I don't want you to remember anything.
Right. And then, if some sedation has already been given to the patient, of course, what would the recovery time? Will they be straight away going to the work, or they will have to have some unpleasant effects of balloon? What can you just throw some light on the unpleasant or the side effect of the balloon?
Yeah. Okay. Good question. So I think the first question is, what are the side effects when you wake up from the sedation?
Yeah.
You wake up from the sedation within 3 to 4 minutes.
Right.
Okay. So you may be a bit drowsy. You'll be in the room. You'll be a bit drowsy, but within about 10, 15 minutes, you'll be pretty much back to normal. Right. The first 4, 5, 6, 7 hours, you actually feel absolutely normal. Okay. Right. And patients have no symptoms.
Right.
Symptoms that tend to start within the first 24 hours, 48 hours. And that's usually nausea, vomiting, and abdominal pain. So pain in the tummy. Now you can have all three, you can have one, you can have two, you can have none. If you're lucky, you can have none. Okay. And they typically last for 2 to 3 days. Mm-hmm. But I always tell patients, it's not a complication. A complication is something that we don't anticipate. Here we know it's going to happen. Because we know it's going to happen, we can deal with it. So patients, when they are discharged, we actually tell them, listen, this is your medication for this is medication for this, and we have 24-hour availability for backup. So other than, let's say, 3 days of you have to put your life on hold because you may get nausea, vomiting, or pain, nothing else.
Yeah. And if I may add, sir, with your permission, of course, that we've seen patients, having nausea and vomiting. It can persist till about 10 days as well. Of course, that depends on person to person. And there are patients, of course, who have practically experienced none of the symptoms, right, sir?
Absolutely. That's medicine, isn't it? I mean, medicine is never absolute. So you're right. Some patients have had zero symptoms. Some patients have had symptoms going on for a week, 2 weeks also. And they vary from nausea, heaviness, discomfort, hiccups. So small, mild symptoms. My point of 3 days is 3 days are the symptoms that you will probably need some sort of medication from our end.
Correct. So, I mean, this is what we have talked about, the treatment for treating the nausea and vomiting. But are there any risk with the balloon, in place, because it's a foreign body coming into the stomach? So, are there any risk involved?
Anything has a risk. You're right. I mean, even driving to the clinic to get the balloon inserted or removed carries a risk. So you're right. It's a foreign body. Yes, it is. But don't forget, we're not putting the foreign body into any tissue in the body. It's actually sitting in your stomach. It's not going into any flesh of the body. And the balloon is made of silicon, which is surgical grade silicon, which, if you think of it, is used across the world for implants. People have it for breast augmentation and so on and so forth, where it's sitting in the body for 20, 30, 40, 50 years with no side effects.
Right.
So the material used is not plastic bag material from Sadar Bazaar or something, right? This is proper surgical grade material. So there's no real complications from that perspective. Yes, if you go into the data, you will come across balloons bursting. You will come across more serious complications, the balloon bursting, going forward and getting stuck in the intestine. But Prateek, our complication, right? We've had, in all those procedures, we've had one balloon bursting. And that was also because the patient came to us after 9 months.
Correct.
Right? And just for your viewers, just to let you know that the fluid we put in the balloon, we actually put a dye called methylene balloon. And the patient had the balloon burst, the dye leaked, it gets absorbed, and the patient went to the toilet to pass urine. And his urine was blue in color.
Right.
And we have told patients beforehand, if the urine turns blue, it means the balloon has burst. He phoned us up, he came to us. By the time we endoscoped him, the balloon had not fully leaked out. So he was in no danger. Right? But the way we have a responsibility, patients also have a responsibility. Follow instructions.
Sure. So, I mean, by bursting means it's going to be exploding, or it's going to be just
That's
a leak?
the point I'm making.
Yeah.
It doesn't explode. It leaks out. So think of a holy balloon, right? And you have a very, very, very tiny leak, and it starts deflating very fast. After about halfway through, it starts slowing down. You come back after 4 hours, you still have a small amount of fluid there. And that's what protects you. That small amount of fluid actually makes the balloon stay in the stomach, giving us plenty of time to go in and re-endoscope. And I'm talking about 6, 7, 10, 12, 14, 24, 48 hours. Up to 48 hours, your balloon can still stay in the stomach after leaking. I think I'll rephrase, it doesn't burst, it leaks.
Right. And, just to prevent that leakage, so is there any kind of a specific diet that a person has to follow, or exercise or something that
no,
we need to?
Really. I mean, you could argue people should not eat fish with bones and all that stuff, but, whether you have a balloon or not, I'll say don't swallow a bone in any case. So, I mean, I remember someone coming to me and saying to me, he's going to Holland and he wanted to do bungee jumping out there. And I said, do it. I don't care. Don't go for professional boxing. Sure, I take that point, but your life should be normal thereafter. Diet-wise, of course, there's a different aspect of diet to lose weight, but
Sure.
diet to protect the balloon, no.
No. And what about some exercises like, maybe if we have like a direct abdominal exercise like crunches or
No,
maybe a heat therapy? I don't, so
no. Your
yes,
life should be normal. Sure, I may ask you to for 3, 4, 5 days to take extra precautions, but
yeah,
for all practical purposes, what you did before the balloon, you should be able to do after the balloon.
yeah. So if I may, interpret into it, so this is going to be the safe if we going to be working up after the balloon insertion, we are going to be on a normal lifestyle as well, right?
Yes.
So what makes balloon different than the diet or the exercise or the gym, sir?
Well, I think if you say how is balloon different from diet and exercise, I would
Yeah.
actually say rather than a balloon being different, a balloon program
Yeah.
is a better word, and I'll tell you why. Because a balloon program is actually a balloon with lifestyle changes, and that basically means diet and exercise. So if you say I am going to do the balloon, I'm going to come to the doctor, get the balloon, I'm going to go away, and I'm going to come back in 6 months and take it out from the doctor, not a good idea. It's a program. It's aimed at a lifestyle change along with lifestyle education. We can do what we can do. The more you do as a patient, the more likely you are to lose more weight, and the more likely you are to carry on losing weight or maintaining weight loss. So I always tell patients, losing weight is difficult. Maintaining weight loss is easier.
Absolutely.
Patients come to me with diets, with exercise, very, very religiously followed. 1 week, 2 weeks, 1 month, 2 months, 3 months, on the weighing scales, 2 kilos, 3 kilos. It's disheartening, Prateek.
Right.
The reality is disheartening.
Correct.
Balloon kick starts weight loss. Some people you've seen, we've had, I won't take names obviously, but you remember 55 kilos, 55 kilos, astounding, right? But the reality is most patients, 15, 20, 25 kilos. And if you suddenly stand on the weighing scale after a month and you are 8 kilos down or 18 kilos in 3 months, wow, you feel good about yourself. It drives you to even do more on your part.
Correct. I mean, when you see yourself in the mirror, you are a new you, of course.
Yes.
So,
there's nothing better than someone coming to you and saying, you look good. Honestly, I mean, it doesn't matter who you are, male, female, age. Someone comes to you and says, wow, you're looking really good. It's so not reassuring. It's so comforting, and it drives you to say, listen, I've lost 18 kilos. My aim is 70. I've got 4 more kilos. You will work harder. So I can't compare balloon to diet and weight loss. I can compare a balloon program to diet and weight loss.
Yes.
It is one step beyond. I think most patients who are going to be looking into an intragastric balloon have been through diet, Prateek. They have been through weight loss. The reason they have reached here is because, like most people in the world, you've tried and you failed.
Sure. I always say to patients when counseling that, if you have already tried all the things, then, coming to the doctor would be the last resort for a weight loss, I would say. So, but then, there is a gap between diet, exercise, gym, and a surgery. So that is why I think, where balloon actually fits perfectly, or do you say that, balloon is not just for bridging up the gap, or it is, it can be used for, who can use the balloon then?
So, it's like saying I have a $1 billion and I have $1. What about all that in between? So it's like saying I'm going to diet and gym, or I'm going to do bariatric surgery. Wow, these are two ends of a spectrum. What about all the options in between? That's where balloon fits in beautifully. So who gets it? Without going into details, for all practical purposes, BMI of around 27.5. Upper limit, if you look at international guidelines, probably about 40 BMI. But internationally also, and we as a program have used balloons on patients who have been 55 BMI and have been refused surgery. So let's say you've got a 50, 55 BMI patient, diabetic, hypertensive, heart disease. The surgeon says, listen, I'm not touching you, it's too high a risk. They came to us, they lost 15 kilos, they lost 10 kilos, lost 20 kilos, went back to the surgeon, and the surgeon said, okay, you know what? Now I can do it for you. So there is no hard and fast rule. We have done, again, I can't take names, but if you remember, there was a young lady who did it she wanted to lose weight for a wedding. And, and why not? You know, I mean, the most important day of her life, just to feel good about herself.
Right.
She wasn't super overweight. She was probably about 28, 29 BMI. And we've had the usual 32, 35, 38, 40. So I would say in anyone in the spectrum on 27.5 to as overweight as possible, I think that's for you. There are very, very fixed guidelines for patients for bariatric surgery. Okay. And if I'm not a surgeon myself, but if I'm not mistaken, the guidelines are 32.5 and above with one associated medical problem. So what about all the other people? What about a person who's 31 with who wants an option? What about a person who's 34 who doesn't have any medical condition? Are you saying there's nothing for you? Just go to the diet and gym? No, there are other options for you.
Sure. So there are plenty of people who are actually, you know, not fitting into the criteria of diet, exercise, or, you know, are scared of surgery maybe because, you know, surgery can have its complications, of course, surgery, but they can fit in perfectly with the intragastric balloon. And, you know, at a later stage, maybe, you know, go for a surgery or being into the maintenance of the weight can be done up through diet, exercise. And, you know, because in our experience, I have not sent anybody to a gym for that matter. You know, we have always suggested them to have a brisk walk, right? So that way, of course, you know, balloon bridges perfect gap between the extremes, I guess.
Yes, but again, I would repeat that don't stop what you were doing in the first place. So as I said to you, you know, if you go to a gym and you diet and you don't lose weight, it's disheartening, Prateek. Right. And if you get something that kickstarts it,
correct,
and you lose 12 kilos, 13 kilos, it drives you to actually carry on losing weight or sustaining weight loss. So these people, some of them are gym people, but they didn't carry on because it wasn't working. So once you lose 10, 12, 15 kilos, then they'll say, okay, you know what, let me carry on with the gym. I don't want to put the weight on, for example, or I want to lose an extra 3, 4 kilos.
Yeah. And I remember, of course, many of the patients who were actually scheduled for the surgery came to us for intragastric balloon, and they lost quite a bit and they were pretty happy about the result and then went for another balloon, right?
They canceled. Yes.
So I mean, I would be, you know, very happy if you can just share those experiences with the viewers, of course.
I was thinking of this when you were talking about this earlier, about bridging the gap to surgery. We've only had 1 or 2 patients who actually were super obese in terms of 50 plus BMIs. But you're right, the majority of the people who have come to us, first of all, well, you know, let's say 32, 35, 36, 37 BMI, they've lost enough weight to any case not require surgery.
Sure.
Then you've got the patients who are maybe about 40 BMI and have come down to 34, 33, 32, and they have come back. So I think we've had, correct me if I'm wrong, one patient has had 5 balloons in 10 years. Is it 5 maximum?
Four balloons
maximum. And we've had many people who had 2 balloons. And it's been essentially for added weight loss. I've lost 12 kilos. I've taken the balloon out. I've come back. I've lost another 8 kilos. I've taken the balloon out. So it's not that you are necessarily putting the weight back on and you want to lose the weight again. It's more of an addition to, I want to carry on sustaining weight loss.
Correct.
So these people haven't gone for surgery.
So now, if we are talking about the weight loss, in your experience, what's the amount of the weight loss that you can lose with intragastric balloon in 6 months' time? Like,
so international data, 40% excess body weight, right? That basically means that, let's assume for my height, I should be 72 kilos.
Right.
And if I am 25 kilos excess, I will lose 40% of that excess body weight. Correct. So I will lose 10 kilos of that excess body weight. Now, a few years ago, on your invitation, I presented in LNJP hospital, if you remember, and published our data. And it was, we have 48% excess body weight loss. So around half of your body weight that you have extra, you should lose with the balloon. That's not to say you lose 50%. You may lose 30%, you may lose 60%, you may lose 70%. One of our greatest successes was a 92 kilo lady who came down to 62.
Yes.
And she went public, if you remember, one of the few patients of ours who was willing to go public and actually advertise it, if you remember,
Yes,
you know,
yes,
and
yes,
so
yes.
so 50% excess body weight loss, rule of thumb, is what we expect.
Right. Now, as you know, after listening to you, intragastric balloon looks a very, very convenient procedure, if I say so, to start up or kickstart your weight loss journey. Then why it is not been propagated or advertised? Why is still a hidden gem, as I've actually written down the title, of course. So,
So it goes back to the previous answer
yeah,
about this lady who agreed to go public. Prateek, in 500 plus cases,
yes,
not one patient has agreed to go public that it was the balloon that made me lose weight. Unfortunately, in India and other parts of the world, obesity is seen as a stigma rather than a medical disease. If I
correct.
have a heart problem, I'll tell people I'm going for heart surgery to this
Yes,
hospital, this doctor. If I have obesity, I
yeah,
will not tell people I'm going for treatment.
yeah,
So people have not, uh, you know, we've had people who've come to us who haven't even told their spouses.
yeah,
Yeah,
right,
we've
right.
had that, right?
Yes,
So
yes, yes.
so when and I don't blame people to some extent. You know, someone comes to me and says, "Oh, you're looking really good. You've lost weight," and I say, "Ah, you know, I've been cutting down. I've been going to the gym. I've been going to the walk." And people do want to take a bit of credit. I understand that. I see the
Right.
reason behind it. At the same time, it's a shame because it has stayed hidden.
Yeah,
So people have not known about it or have not known the benefits about it, and they have missed out. So
right.
you know, in the Western world, it's still more promoted. It's still accepted that weight loss is a disease. India, it's not necessarily accepted.
Right. And you know, in most of the counseling sessions, of course, we have seen that there is a bariatric support group. I haven't gone through any support group of intragastric balloon, sir. You know, there have been like intragastric balloon is not new,
No, correct.
right? So, but I even if I talk about even the you know outside India data, there is not much of the intragastric support group. So is it the same you know the stigma that patients have?
I think one is that I think, you know, when you have a support group, normally a support group is for a chronic disease,
Yeah.
right?
Okay.
So are there support groups for obesity? Yes, there are.
Yes.
But if you
Yes.
are getting an intragastric balloon and you are losing weight,
Hmm.
you don't want to stay in touch with the obesity group. You see my point? It's like saying I've got cured, and I was a member of this group, but
Yeah.
that's because I was obese. Today I'm not obese. So
Right.
you want to leave that past behind you.
Correct.
And of course, I think also in India, I think patient support groups the concept hasn't picked up, unfortunately. I
Yeah.
think in the Western world, you know, example IBD, inflammatory bowel disease support groups, IBS support groups, very very common, very predominant, very very supportive, very professionally run. In
Right.
India, we don't really have support groups.
Yeah. So this is I think the basic reason behind you know that intragastric balloon has not been propagated in a larger perspective for weight loss as such. You know, I know you can also vouch for that I've been giving so much of the awareness to the people by you know in terms of articles, but you know still the numbers are very less in terms of I talk about you know surgical procedures.
Yes.
So that is I think unfortunate in our case, but I have always been a balloon guy. You know, I have balloon to
India,
you know close to my heart. You know,
I
but
remember.
yeah. So it has been a case that you know I would love to see balloon. You know, to that higher level, and that was the idea. You know, when I introduced balloon in India. Uh, Now, if I talk about just a balloon per se, you know, there are now different types of balloon which has been in the Indian market. So can you just throw light on it? Because I want everyone to be aware that there are balloons in the market and they should definitely go for it as well.
Okay, so you're right. There are different kinds of balloon, but the
Yeah.
bottom line is all of the balloons work on the same principle.
Yep.
It doesn't matter which company you choose, which shape you choose. The idea is you put an inflated balloon into the stomach. It causes a feeling of fullness. People don't feel hungry. So it
Yeah.
doesn't matter what shape it is. But now that you've asked me, what are the different kinds? So there's an old-fashioned one which is being used, which is old-fashioned doesn't mean it's out of vogue or whatever. It's actually the most tried and tested. It's a normal balloon which is round-shaped. It stays in the stomach, and that's the one which is being used all over the world for over 30 years probably.
Yes.
Right?
Yes.
In the past 5 years, when suddenly America joined the bandwagon. If you remember, it was not really used in America, and now suddenly in America, the balloon has become really, really big.
Yep.
I think because of that, more and more companies have come out. So
Correct.
you have a second balloon, which is an inflatable balloon. So I think I'm jumping the gun. Let's start again from the beginning. The balloon that we have historically used, we inflate with, let's say, 600 ml of fluid. Once you inflate it, it's done. You leave it in the stomach. You go back in 6 months, you take it out.
Right.
The new one which has come out, which you can re-inflate if you like. So you put in 500, 3 months later, the patient comes, he's lost a bit of weight, he stopped losing weight, you can go to 600, again, 2 months later they come, you can go to 700. So that's another one which has come up, which is a new one which has come, and it's available in India.
Yep.
You also have the double balloon, which is basically 2 smaller balloons. Now that's very new, not proven, but the rationale behind it is it snugly fits in the whole stomach rather than one part of the stomach. Okay. So I would not advocate that as of now till more evidence comes.
Sure.
And the last balloon, which is again not available in India to my knowledge, is the pill balloon. It's a small pill-like thing you swallow and you have to inflate it after that. And again, not been proven. So I think the choice is between the conventional balloon and the one where you can readjust the size.
Right. So what are the difference between the two? Like, I mean, what would you prefer, or in your practice, what are you actually
I think conventional rules, even now, for ease. You know, Prateek, when we started, if you remember, we were doing 500 ml.
Yes.
The balloons.
Yes.
And then we went up to 600, then we went to 700. And now we've learned, now we've known, now we know case by case how much to put in, right?
Correct.
And the reality is maybe around 600, 620, 630 seems to the optimum. That's not to say we don't put more and less, right?
Right.
The advantage of that is, so you come in, you get it done, and you go away and you forget about everything. And you come back in 6 months. Sure, you have your follow-up with the dietitian and so on, but you don't need to go into hospital again.
Yep.
The second balloon, the one which you can readjust, the problem is, the disadvantage is that you start with X amount. Let's say you start with 500. You have to come back for another procedure, which is then 550, 600, 650, 700, added cost.
Right.
Added visits to the hospital. And in today's times, in the new COVID world, people don't want to, the reality, people don't want to go to hospital. Yeah. And the other thing, Prateek, which you and I have seen, is that people who go for the intragastric balloon are not local residents. Have you noticed that? They will, if I'm in South Delhi, they will purposely come from North Delhi to South Delhi, East Delhi to West Delhi, Chandigarh to Delhi. They don't want anyone to know about it. So people are traveling a large distance to actually get these balloons done. So the disadvantage of readjustable is 2, 3, 4 visits each time, added cost for each procedure. Is there an advantage? Yes, there is an advantage. You put in 500 ml, the patient after 3 months stops losing a large amount of weight, and he says, I want to lose a bit more weight. So he comes in, we inflate the balloon a bit more. So you go to 600, 650, there's a bit more weight loss. So like any procedure, there are advantages, disadvantages. If I had to choose, conventional rules out here, the old-fashioned balloon, which we've been doing for years and years and years, is what I would go for at this moment in time.
Right. And do the inflation volume affect the symptoms, sir? Like, nausea, vomiting, cramp?
Yes.
So, but don't you think, sir? I mean, to my knowledge, because when I'm talking about intragastric balloon, it has to be, a team effort. If we're counseling or pre-counseling the patients about the balloon, and if they're aware of the symptoms would be there. So I think it is always better to have get them for the one-time inflation, and then tell them about that you'll be having symptoms, and rather than making them come back all the way. again and again for readjustments and all the stuff.
Prateek, I think in 10 years or 12 years, we've never had a patient who's walked in and says, I want a balloon, and we put him on the table.
Yes.
The process starts actually days, weeks before the actual procedure.
Correct.
And, the world is an educated place. There's Google, people have done their research, they know the questions to ask. But so when they really come to us, that's already taken care of. And
Sure.
we tell patients, listen, I can put 500 ml. I anticipate this much weight loss. I can put 600 ml. You'll get a bit more weight loss, but you'll get a few more symptoms. And some people are more resilient. They say, you know what, kya fark padta hai, 3-4 days. Let me. I don't care. If I get another 4 kilos weight loss. As some people who come and say, no, I hate vomiting, I hate pain.
Right.
So you have to tailor it to each patient.
Yeah.
It's like an antibiotic, isn't it? You go by weight. You give antibiotic dose to someone a different dose, to a thinner person a different dose. So you're tailoring treatment to each and every patient.
Correct. So I think the best way to make them aware is that, you'll definitely have the symptoms, and it's symptoms, it's not side effects that it will stay forever, right? And it is a treatable symptoms.
Yes.
And we have actually seen that patients who have the symptoms lose more weight, I guess.
Yes, we have, because we put more fluid in the balloon. Yes, absolutely.
Yes.
And
so
also, Prateek, is always ask the patient,
do
you want 4 days of nausea, vomiting, pain?
Yeah.
Or do you want 20 kilos of weight loss?
Correct.
What will the answer be?
I would go for 20 kg weight loss for sure.
No, but that's the reality. People
I know.
Balloon have reached a point of frustration. They have tried X, Y, Z.
Yeah.
They are fed up.
Right.
They are more resilient in terms of side effects. They're fighters essentially.
Correct.
So I don't think that the side effects are a big deal. I genuinely don't think the side effects are a big deal.
Yes, and I think with the side effect or symptoms, we have not taken out any balloon, because there have been instances that patient comes to us that there are lots of nausea, lots of vomiting, and we say that it's a treatable thing. We treat the symptoms then.
Yes.
Yeah.
They're manageable.
It is manageable, right? Of course. So we don't remove the balloon just because of the symptoms. In our experience, we have not done that, right?
So patients are well prepared.
Yes.
As I said to you, people have not walked in and said, I want a balloon. They have met you. They met a dietitian. They may have met me. Everyone who meets them tells them the same thing. We anticipate this. We anticipate this. We anticipate this. They know it's going to happen. There's medication there. So no, I don't think. I'm not trivializing what what the patients go through.
Yes.
But in the big scheme of things, the symptoms are a drop in the ocean of the benefit of what you may get.
Correct. Right. So, if I talk about as a larger picture, balloon is a safe and effective method, but is it a sustainable weight loss method, sir?
Okay. Very important question. And in argument of that, why diet and why exercise and lose 20 kilos? If you think after losing 20 kilos, you're going to put back 20 kilos again, that's question number one. Number two, when you have weight loss, the pride in achieving what you have achieved is enough to drive you to carry on losing weight or sustaining weight loss.
Correct.
Number three, I said this earlier, losing weight is difficult. Sustaining or maintaining weight loss is easier. Once you've lost 20 kilos, to maintain that weight loss is easier. And forget the emotional part of it. Let's go to the science of it. What does the data shows? The data shows that people who lost 40% excess body weight loss, after 1 year after removal of the balloon, had continued to lose 30% excess body weight loss. So yes, they had put on some weight. This is a spectrum. They had put on some weight, but the weight gain was not what people anticipated. People said, take the balloon out, you'll go back to your previous state. No, not at all. And there's a reason for that. There's a through and through cultural change in people's eating habits.
Yes.
You go to a wedding and you pick up a plate, you're talking to the person behind you without thinking you'll pour your food, you're not measuring what you're taking.
Correct.
With the balloon, automatically, subconsciously, you pick up less food.
Sure.
Right? 6 months later, you take the balloon out, automatically you'll take one chapati. I've always taken one chapati, I'll carry on taking one chapati. You suddenly don't start eating 4 chapatis.
Sure.
So there's a conditioning which has happened, which is why I said to you, it's not just a balloon, it's a program.
Right.
So are you going to put on weight? Sure, if you eat rasgullas and and chocolates and ice creams, sure. No, I mean, and even if you have bariatric surgery, you put on weight.
Yes.
But the reality is, you will continue to sustain the weight loss
Right.
for many factors.
Correct. So, if I may, answer this in a simpler way, that if you are going to be in a balloon program, so the way that you are going to be eating throughout your 6 months time, if you maintain it and continue eating accordingly, or continue following that for the rest of your life, I think that serves the purpose of maintenance, I guess.
Yeah. But that's like any patient who comes to me and says, "Doc, what should I do?" And I'll say, lead a healthy life.
Right.
And what is a healthy life? Eat healthy and be physically active, stop smoking, stop drinking alcohol. So whether you're obese, or whether you have heart disease, or whether you are a 40-year-old healthy person, that advice is standard to anyone.
Yeah.
So if a person who's lost weight or has not lost weight comes to me and says, what should I do? I'll say, eat healthy and exercise. So that's enough to drive you for a normal life, healthy life.
Absolutely. So, I mean, we have actually, I think, answered all the questions that we were having. At least what I was having in my mind, and I wanted to express it through you, that how the intragastric balloon is also an important program or important procedure in a weight loss program, which not many people know about it, I guess. That's why it is a hidden gem, as I always say. And now that you have actually cleared it very nicely, that it should not be a hidden gem anymore, I guess. It would be just a gem in the obesity treatment package. And during our conversation, of course, there have been lots of questions which have come up through our viewers. So if you may allow, I can actually start up with the questions, if you're okay. Right. So the first question which comes up will be, how would I know that the balloon is good for my weight loss regimen?
How will I know?
Yes.
Okay. The fact that you're on the show means, honestly, the fact that you're actually watching the show means that you've got a problem with the weight and that you have failed in plan A.
Right.
Right. When you fail plan A, you go to plan B. Now, if you say to me, my plan A has been dieting, but I have not done exercise, I'll say, you know what? Don't do the balloon. Go and do plan B, do exercise and lose weight. But if you've done plan A, you've done plan B, you've done plan C, the balloon is for you. End of the story.
Sure.
The balloon is for you. And, should I do bariatric surgery? Sure. Then it depends on what is your weight, what is the comorbidities, do you have any other disease? But I think anyone who's got a weight issue, who has failed to do it the old-fashioned ways of diet and exercising, needs a bit of help. It is not, I repeat, it is not a cosmetic procedure. It is a health treatment. As simple as that, Prateek. You are at risk of diabetes, high blood pressure, high cholesterol, heart disease, kidney failure, you name it. It is a treatment.
Right. This was actually the coming of the question that, it is a cosmetic, it's not a cosmetic thing, right? So will it be covered under insurance? That's the next important question which has come up, sir.
So unfortunately, no. And correct me if I'm wrong, you might know this, but I think if you live in Italy and Brazil, it is covered. So if you have insurance in Italy or Brazil, yes. In India, unfortunately, even bariatric surgery has taken a long time to be covered under insurance. It's only happened in the past few years. It's not even across the board. Not everyone is getting it. So unfortunately, as I said to you before, obesity in India is not perceived as a disease. It's perceived as a stigma.
Right. Absolutely.
That's that part.
Yes. The next question comes up is, what is the best way to reduce weight? Is that surgery, medication, change in the lifestyle? What exactly can we do?
Change in lifestyle, categorically number one. If you say to me, I have used change in the lifestyle, I have failed, I will say to you, don't abandon that plan. Whether you choose balloon, whether you choose bariatric surgery, whether you choose change in lifestyle has to go alongside. You can't say, I'm going to get a magic treatment or medication or balloon or bariatric surgery, and that will allow me to have a lazy lifestyle and overeating and so on and so forth. So change in lifestyle, number one. After that, I'm not a fan of medication. I'll tell you
Yes.
why I'm not a fan of medication. There's not been a lot of data supporting significant weight loss for medication. I think medication is used in addition to other procedures. So I've actually used medication in my balloon patients and some patients after month 3, month 4. But I think start with lifestyle.
Yeah.
Doesn't work, move on to balloon. Doesn't work, move on to bariatric surgery.
All right. Perfect. So another question which is coming up is that, uh, it's actually from a female patient of ours who's actually asking that will the PCOD or thyroid be affected with balloon insertion, or is it a good option for a PCOD or a thyroid patient?
Thyroid, no. There is no association of so underactive thyroid causes weight gain. Weight gain or weight loss does not cause thyroid.
Right.
PCOS is associated with weight gain, and so PCOS causes weight gain causes PCOS, and you get stuck in this cycle. Sounds very unscientific, but that's the reality. So yes, your PCOS will come under a bit of control if you lose weight. To answer that question, yes.
Yeah. So with the balloon in place, is it going to be affecting the, that's the next thing which is coming up. So will that affect the cycle, the PCOD cycle, or is it gonna be better with the PCOD patient?
Yes, I think PCOS symptoms will. So what are the symptoms of PCOS? There's an abnormal menstrual cycle. There's difficulty to conceive in some people. There's obesity, and there's excess hair growth. These are the common 4 symptoms.
Correct.
Obesity, by reducing obesity, PCOS is a hormonal imbalance.
Yes.
By reducing your weight, you will actually reduce the symptoms of PCOS. You're not curing it because it's not a disease in the first place, it's a symptom, but the symptoms are reduced. It's not going away.
Okay. So symptoms would be reduced, of course. And so if I mean, please correct me if I'm wrong. So the balloon is not gonna affect in any of the PCOD symptoms, but it would help in the weight gain.
It will reduce your weight, and as a result, some of the symptoms of PCOS will be. I know we keep saying PCOD, PCOS. The reason I'm correcting you is
same.
Because PCOD stands for polycystic ovarian disease,
and
it's not classified as a disease; it's classified as a syndrome. So, so it actually reduces the symptoms of PCOS.
All right, perfect, great. The other question which is coming up, sir, is that do we need to resort to procedures such as skin tightening post weight loss balloon program?
I think someone like I mentioned earlier, a patient who lost 55 kilos. I think, yes, you would consider something like that. But I think the average patient who is looking at 15, 20, 22, 23 kilos, I don't think it's required because along with the weight loss, there's also other lifestyle changes, and the tone of the skin is, you can tighten the tone of the skin through exercise. So no, I have never sent a patient for plastic surgery after weight loss. I'm not sure about you, whether you've actually had any patients.
In my experience also, we have not actually sent anybody for the skin tightening.
Yes.
I mean, we have always focused on the gradual weight loss rather than, all the weight loss at one.
Yes.
So that will actually, limit the skin sagging, I guess. Right. So that way we have not actually sent anybody for the plastic surgeon or for the skin tightening per se as a procedure. They have actually got quite an inch loss, if not the weight loss as well with the balloon, right? So they're pretty happy about it, and they have not actually gone to any skin tightening program, in our experience at least.
Yes.
Yeah. The other question which is coming up is that, do you suggest a patient should undergo a second procedure if one has not achieved the desired weight loss? A second balloon procedure.
I think there's a role for it. Absolutely. I think after a 3-week gap, and that's not a hard and fast rule, you can have it on the within 1 day or within a month later. I think some people, you see, Prateek, with our experience and across the board, across the world, the majority of the weight loss is considered about 3 months. Because in about 3 months, and the next 3 months is either a small amount of weight loss or a maintenance phase, right?
Sure.
And we found that when you take the balloon out, if you give some time for the stomach to contract again to its normal size, wait for 2 to 3 weeks, reinsert a balloon, again you get the weight loss for the next 3 months.
Right.
So I think patient by patient, if you haven't achieved what you've wanted, but you've achieved a good amount, I think a second balloon has a role for it. Yes.
Fantastic. So, is it mandatory to get it done, or should we wait for them to at least have some kind of a maintenance done up by their own, or should we straight away put in the balloons?
Second balloon?
Yeah.
No, no, not at all. I mean, I think I think in our cohort of patients, about 500, I can't 20, 30, 40 maybe have had two balloons.
Yes.
Right?
Yes.
I don't think more than that.
No.
And that's telling you that 90% don't require it.
Correct.
So I think that depends on have you achieved what you wanted? Number one. Number two, was it successful in the first place? So let's say you come to me with, let's say you're 45 kilos overweight and
Right.
you've lost 25 kilos or 22 kilos. Brilliant, right?
Yep.
Brilliant.
Yep. Absolutely.
But you still have 22, 25 kilos more. So because the balloon has worked so well the first time, there is good evidence to suggest the balloon will work very well in you the second time as well. But the timing between balloon 1 and balloon 2, there has to be a certain few weeks for the stomach muscle tone to go back to its normal state for the benefit to happen.
All right, because I've seen many doctors actually putting in the balloon the same day as the removal is done. So do you think that is the right approach? I don't know.
I have done it. I have done it.
Okay.
It's distance, but I don't think it's the right approach.
Okay. So
I think you should wait. See, the balloon is sitting there stretching your stomach, right? You've got a muscle which is stretched for 6 months. Take the balloon out. It's going to take time for the muscle to come back to its normal state. That's when I say when it comes back to the normal state, again put the balloon to create that same fullness in the stomach. That stretching sensation in the stomach causes the fullness as if I've eaten a heavy meal.
Right.
So minor point, but I think 3 to 4 weeks break is better.
It is better. All right. So, coming to that point of that, have the enlargement of the stomach when the balloon is there and the muscle would be coming back to the shape. Now, when the removal is done, sir, so there are myths about it that they will come back to their original weight, or, come back to, that the patient gain all their weight after the removal.
No, we've talked about this. The data is not showing that. The data is showing a small amount of weight gain. As I said to you, there's a 40% excess body weight, international data. After 1 year of removal of the balloon, you are still at 30% excess body weight. You only put on a small amount. And there are multiple reasons. It's cultural. It's about training your eating habits. It's the pride. It's a new lifestyle. It's a new beginning for you. So I don't think that, it's again, a lot of people who go on dieting and exercise, Prateek, they don't struggle. They struggle to lose weight. But if they lose weight, I'm talking about a significant amount of weight, very few of them go back to how they were. Correct. If you lose 20 kilos, very few of them go back to 20 kilos back again in life. Let's put it this way.
So it's not practically a yo-yo effect, is it?
No, it's not a yo-yo effect. If it was a yo-yo effect, let's put it this way. Yeah. If it was a yo-yo effect, it would not be still around 30 years after it was invented.
Sure. It is still sustaining in the market, of course.
Yes.
Yes. And if I that's my personal question, of course, that when the balloon is out and when the balloon was inside, you'll have the reduction of the food intake. When the balloon is out, you'll start eating more. Then what to do for that? No,
you won't start eating more. Your appetite is suppressed. There's a lifestyle change in 6 months. It goes back to the wedding example. You go and you pick up one naan or 2 naans. You do it without thinking. 6 months afterwards, I'm not saying that you don't have to make an effort. Of course, you have to make an effort in anything. You're diabetic, you have to make an effort. You can cheat, but you have to make an effort. There has to be a discipline on your part.
Sure.
But are you going to go back to your normal eating habits? If you have a balloon, Prateek, it's a big sacrifice, right? You made a big decision. You're not going to throw it away.
Right.
You've achieved something. It takes a lot of courage. Honestly, it takes a lot of courage to pick up the phone and actually phone you.
Sure.
It does. It takes a lot of courage to pick up the phone and phone someone, then go and meet the doctor, then get it put in, then lose the weight, then take the balloon out. You are not going to throw it away. If you have achieved 25 kilos weight loss, trust me, you are so proud of yourself. Proud of yourself. You would not throw it away.
Sure. So the next question is coming up, that how many days post-procedure required to restore normal life and work?
Next
Next day itself, straight away.
We talked about insertion, 3, 4, 5 days you need. Removal, next day. Normal.
Next day itself. Okay, fantastic. And important question is again, should the patient be in touch with the team of doctors after the removal of balloon?
Absolutely. The more, it's a program, the more you follow up with your team, and the team can vary from a physician to a dietitian. You even have, in some of the parts of the world, you even have psychiatrists.
Yes.
And you have psychologists, and the more you follow up with your team, whoever your team may be, the better for you. It is categorically more successful.
Yes. So, I mean, after the removal of the balloon, you're still in touch with the doctors, of course. So,
yes.
So that is just for the maintenance, or you can still lose weight?
No, after you've removed the balloon, you mean?
Yes, sir.
No, correct. So I think it's, I think it's for maintenance. I think also once let's say you removed your balloon,
right?
6 months down the line, you have not put on weight.
Yes.
You don't want to speak to the doctor then. You only go to the doctor when my wife doesn't want to speak to me, so I can understand. So people don't want to go to doctor when they're well. So I think you're more than welcome to stay in touch with us, and if you phoned us up in 12 months and said, doc, I'm still minus 20, I think that's good feedback for us, and we'll feel proud of it as well. But I don't think you need to. Let's put it this way.
Correct. I remember, patients who used to only call us when they have some kind of a problem of nausea or vomiting. That's initial days, of course. After that, they were absolutely fine, and we have to, call them up. And of course, because yes, yes. So they were so happy with the results that they wanted to keep the balloon at least for 3 months, 4 months down the line more than the scheduled date of removal.
We should say this, Prateek. We should say this live. It is not recommended beyond the stipulated time. It's a danger to the patient.
Right. Absolutely. Last question, and very interesting one, is that can the person continue having alcoholic drinks with the balloon, sir?
I will never stop you having a drink.
Right. Absolutely.
I will never have a drink with you. No. As long as you're drinking within limits and medical limits, and I won't go into details. Of course you can.
You can, but in limit, is it?
That's what I'm saying. There are limits, and if you want to know details, it's considered about 21 to 28 units for a male, and 14 to 21 units for a female per week. Again, I'm not going to explain what they means, but small amount of alcohol. Sure, whether you have a balloon or not, you should not be drinking a lot of alcohol.
Yeah, absolutely, totally by your point for that. So I think we are done with the questions, sir, and I would like to have your final thoughts on the topic, on the intragastric balloon, and some message that you can obviously convey to the viewers as well, sir.
The first thing, I think your patients, your viewers had better questions than you had for me. That's the
sorry, sir.
No, I think my message is not about the balloon. Actually, my message is about if you are overweight or obese, it's a medical problem. And don't let anyone convince you that it is not a medical problem. It is actually a disease in a way. And some people say, it's your fault. And by that definition, people who come to me with liver disease from alcohol, or smokers who get lung cancer, don't treat them.
Sure.
Right? By that definition, they should not be treated. Everyone deserves a second chance in life. Reality. We've all made mistakes. It may be your mistake. It may be a hormonal problem. I don't know. Yeah. The bottom line is, if you are overweight or obese, you need to lose weight in any way you need to, which works for you. If that is that I am going to lose weight by getting a haircut, good for you. But if you've tried diet, you've tried exercise, please remember there are other options. There are medications. And again, I said I'm not a fan, but there are medications for people who are 3, 4, 5, 6, 7 kilos overweight, or in conjugation with balloon. There's a balloon, and there is bariatric surgery. The program is talking about the balloon, but it doesn't matter what works for you. If you lose weight, hats off to you, whatever method you find.
Yes, absolutely. So I think that sums up our live session, guys. And I think you have heard Dr. Vivan saying that, intragastric balloon is not just bridging up the gap between dietitian, diet, exercise, gym, and bariatric surgery. It could be your first first, what's it, or I would say that, it's like a kickstart your weight loss journey. That could be your first step. Intragastric balloon could be the first step, and it should not be that, you are not aware of it. There are n number of articles about intragastric balloon. There are n number of people, even doctors, talking about intragastric balloon. So you should be aware of all the possible solution for your weight loss.
Prateek, I'll interrupt here because
Sure.
you said something very, very important.
Yes, sorry.
It's actually, people just need a bit of help to start the process. As I
Correct,
said,
correct.
if you lose, if you're going to diet and lose 1-2 kilos after 3 months, it's demoralizing. If you're starting a race and
Yeah,
someone says on your marks, get set, and you cheat and you before the gun is fired, you run. I think you'll win the race. So
right.
you need is someone to help you, guide you. And I think because of this is 13 years now in India, 14 years in India because of your
Right.
effort. Doctors available pretty much in every single city. This is not
Yeah.
about Vivan, Talwar or Prateek, Mathur. There are
Yeah.
doctors available in every single city, from A towns to B towns to C towns. You've got in Lucknow and Surat and in Ahmedabad. I've talked to doctors. I've talked to doctors over the phone for this.
Yes.
There are people all over the country doing this now.
Yes, absolutely. So it is a far-fetched procedure now, and being an endoscopy procedure, it requires practically, very limited time for you to recover as well. So it is a safe and effective method of weight loss without a scar on your body as well. So it is a secretive procedure, but we as a balloon people would want everyone to come up and talk about intragastric balloon. It's not a taboo. It is not a taboo. If you have lost weight, you should be proud of saying it to everybody.
Yes.
Right, sir? So I think with that we can end up the session, and thank you so much again for joining us and enlightening us for this important
No,
procedure called intragastric balloon, sir.
other way around. I think thank you for inviting me. I'm actually honored and privileged that you actually thought me worthwhile to come on the show, and that's an honest, sincere answer. Thank you, Prateek.
Sir, come on. You've been a mentor, you've been proctor, so of course, always a pleasure to be having you.
Thank you.
Right, sir. Thank you so much for your time, sir.
Okay.
So with that, we'll just end up the session, sir, if it is fine with you.
Sure. Thank you.
Great,
Bye-bye.
great. Great, sir. Thank you so much for your time.